Thank you for keeping it on Great Day SA. If you are suffering from circulation issues, leg pain, or even numbness, or find that everyday physical activities can be a bit difficult, you may want to learn more about Espada Vascular of San Antonio. Justin Calderon has more.
Well, I'm joined by Dr. Jeff Martinez over here at Espada Vascular. Doctor, good morning. Thanks for having us.
Good morning. Thanks a lot.
Hey, no problem. I'm excited to talk about all the services you provide over here. But doctor, for those who don't know, can you tell us about what is a vascular surgeon?
Sure. So vascular surgeons take care of diseases of the blood vessels, and it's pretty much all the blood vessels outside of the heart. So arms, legs, neck.
Can you tell us a little bit about a PAD? I know that's a condition and a disease that's really prevalent here in San Antonio, peripheral artery disease. What is that?
So peripheral artery disease is basically poor circulation or blockages in the arteries. And at Espada Vascular here, we focus on the lower extremities. So what we're really trying to do is treat the disease that causes the most problems. So the most severe form of PAD is what we call critical limb ischemia. And that means that you've got such poor circulation to your lower extremities that you have constant pain in your feet. You may have an ulcer that's not healing, and you may even have gangrene. So that puts you at a high risk for losing your leg.
It's very important to get that checked. And doctor, what other conditions do y'all treat over here at Espada Vascular?
So really we treat PAD. That's what we treat in this clinic, and we really focus on amputation prevention. We use a lot of different techniques to get blood flow. Our diabetic population typically has disease below the knee, so a lot of blockages even into the foot. So there's a lot of open surgical options that aren't really available to them. So we use a lot of techniques with wires and catheters to get through that blockage and reestablish that flow.
And doctor, can you tell us a little bit about the treatments options you offer over here at Espada Vascular and how y'all help people gain back that quality of life?
Sure. So everything we do is minimally invasive here. All the open stuff would be done at the hospital, but everything's done just through a needle puncture under sedation. And you're laying on this fine table here. And we use different wires and x-ray techniques. We have ultrasound that goes inside the blood vessels to give us a 3D view of these things, and we work to get through the blockage. And once we're through the blockage, then we can do things like shave the plaque down or use a balloon to expand the channel and restore the blood flow, save the leg, and prevent amputation.
And doctor, if somebody watching out there, they're experiencing like pain and numbness in their legs, when is the best time to go get that looked at?
So if you're having pain all the time when you walk, it's an important time to get seen and evaluated. But certainly if you have constant pain in your foot, especially with discoloration, that's a strong warning sign that you need to be looked at. If you have a cut or a sore on your foot or toe, especially if you're a diabetic and it's not healing after a month, you need to get seen by a physician. And then obviously if you have an area on your foot that's turned black, that can be early gangrene, and you want to get that looked at right away as well.
Well, doctor, it is no secret that diabetes is really prevalent in our community. Is there anything that y'all do over here at Espada Vascular to help combat that?
Yes, there is some new thing that we've started just this year, and it's called physiologic insulin resensitization. So it's a lot of words, but basically, if you look at diabetics, the problem is that they lose the sensitivity at the cellular level for insulin to work properly. And so what we're doing is we're giving pulse doses of insulin, little micro pulses, over about a 3-hour period. And during that time, that allows the sensitivity to come back. And so when that happens, the sugar goes in the cell, and the cell starts to rid itself of any kind of inflammatory problems and work properly.
Absolutely, doctor. And if folks are interested in learning more about Espada Vascular, where can they go, sir?
So you can contact us here, 210-540-6766, or our website, www.espadasa.com.
Doctor, I appreciate your time, and thank you for all the services you provide this community.